Assalamu alaikum, the communication day. First scenario, Mr. Jamal Ali, 65 years old, known case of chronic liver disease and esophageal varices. He has been complaining of vomiting of blood. Urgent upper endoscopy was done for him and signed consent. Then transferred to the medical ward. After 3 hours, his condition was deteriorated suddenly and was transferred to ICU. Had a cardiac arrest. CPR done for him, but unfortunately he passed away. You are the senior house officer on call today. You have been asked to discuss this issue with Mrs. Sally, his daughter, who just came asking for her father's condition. Ready, Dr. Azza?
Yes, inshallah.
Okay, here you go.
Hello, my name is Dr.
Hello.
Azam Mustafa. I am the senior house officer. May I confirm that you are Mrs. Sally, daughter of Mr. Gamal, 65-year-old?
Yes, I am.
Okay, Miss Sally, we are here today to discuss the medical issue of your father. Is that okay with you?
Okay, I am here for that.
Okay, before I proceed further, may I know how much do you know about your father's health condition?
Doctor, my father is suffering from disease in his liver, and today suddenly he vomit blood. So we bring him to in the morning. We bring him to the hospital by ambulance. After that, I leave because I went to my work. They call me from the hospital that your father will do a camera test. So I came now to know what happened for him.
Okay, Mrs. Sally, I appreciate your knowledge about your father's condition. Yes, you are right. He came to us with vomiting blood and a camera test was done for him. And he has been transferred to the ward, but unfortunately, 3 hours later, his condition deteriorated suddenly. And I'm sorry to tell you that his heart stopped working. I'm so sorry for your loss, Miss Sally.
What you mean, doctor?
I'm so sorry, but we lost Mr. Gamal.
Oh my God. Are you serious, doctor?
I'm so sorry. I can see how much these news are shocking for you. I'm so sorry. We did all our best to save him, but he passed away.
He was in a good condition, doctor, in the morning. And what happened? What happened uh, to uh, to reach this point?
I'm so sorry, Mrs. Sally, for this bad news. And I am assuring you that we did all the best to save his life. Your father has a serious liver condition, and it is complicated with a tear in his food pipe, as you know. That's why he had this vomiting of blood in the morning. And we did the camera test to try to support his food pipe and to save his life. And we transferred him to the ward after that, hoping that his condition will become better. But unfortunately, suddenly his heart stopped working.
Oh my.
I'm so sorry. If you like, we can arrange another meeting to discuss later if you need any time now. Sorry, Mrs. Sally, for this bad
Doctor,
news today.
I think this procedure was done. Maybe it is that killed him. It's just a procedure.
I'm sorry because you think like that, but the procedure went uneventful, and he stayed 3 hours in the ward after the procedure. He signed a consent, Mrs. Sally. You know, he signed a consent, and everything about the procedure was explained to him. It was to save his life, not to kill him.
Okay, doctor, I want the name of the doctor who does this procedure. I will raise complaint.
It's totally your right, but we work here as a team, and all of us are responsible for what happened to Mr. Gamal. It's not one person.
What you mean, doctor? You are defending your colleague?
No, no, Mrs. Sally, it's not like that. I'm sorry because you feel like that, but I'm not defending my colleagues. I am telling you that we are working as one team. All of us are responsible for the condition of your father.
Okay.
Yes, Miss Sally, I just ask you to give me some time to explain to you what happened. I know how much these news are shocking for you, and I know how much you are upset now.
Okay.
Do you need any tissue? Can I bring a glass of water for you?
No, no. You can continue, doctor. Can you explain me what happened? Why his condition deteriorated rapidly like that?
Okay. It could be due to his condition of liver disease because he had this liver disease for a very long time. And it could be due to the blood that come from his mouth, the vomiting of blood could be one of the causes. Maybe the loss of this blood couldn't be correlated with his body. Okay.
Sorry?
Okay, Mrs. Sally, are you following me?
Yes.
Okay, when his heart stopped working, we did a procedure called CPR. Do you know anything about it?
What is about?
Okay. Okay, it's a procedure when a patient's heart stopped working. We try to make like massaging for his chest, some compression on his chest. And we try to assist his breathing as well by putting some tubes in his mouth. And sometimes we use electrical shocks. Do you know anything about it?
Yes, I see this in the movie and in
What I'm
films.
trying to say, Mrs. Sally, is that we did all our best to save his life, but unfortunately, we lost him. Please accept our condolences. On behalf of the whole team, we are sorry for your loss.
Okay. So what is the further steps, doctor? Can I take the death certificate?
Sorry, I can't hear you.
What is the next step, doctor? Can I take the
Okay.
death certificate?
I'm sorry, Mrs. Sally, this is not going to be from our office. It would be from the coroner office because when a patient die within 24 hours of a procedure, it's a coroner office uh, task, not our task. I refer you to them, and they will explain to you the whole process. Is that okay with you?
Mhm. Okay.
Okay. Do you know the coroner?
Yes.
Okay. Okay. He will investigate about his death because
Mm.
when a patient die within 24 hours of a procedure, we want to know that nothing wrong had happened and to know the exact cause of this, so he can give you the death certificate.
2 minutes left.
Do you have any other
Okay.
concern, Mrs. Sani?
Just I want to know, doctor, why you did this procedure without our consent? Because when they called me uh, by telephone, I said I will come to sign the consent.
The camera test, you mean?
Yes.
We have the consent from your father, Mrs. Sally. We explained to him the whole procedure with all the benefits and the risk, and he signed the consent. He had the full capacity to know about any procedure that is going to be done for him, and he signed the consent. Do you have any other
Okay.
concern?
No, thank you.
May I ask you a few questions, Mrs. Sally?
Okay.
Okay. Anyone dependent on your father?
Yes, all my family dependent on him.
Okay. You need a financial support, you mean?
No.
I can call the social worker? Okay. In such cases, we can help you psychologically. I mean, if you need any help, we can support all the family. And we can make a discussion if you want to be discussed with other family members. If you want to call anybody, we can help you about discussing what happened to your father. I'm so sorry for your loss, Mrs. Sally.
Okay, thank you.
Okay.
Okay, time is up. Thank you. Well done, Dr. Azza. Dr. Hani, you can comment now.
Okay, actually, Plaza covered all the points in a professional manner and in perfect performance. Very good. Actually, يعني the first, the only comment is a warning shot before she start. You can say to Plaza, it gives silent, golden silent before. You can say, Mrs. Sally, after you say that introduction, Miss Sally, I am feeling that I don't have a good news for you today. And make silent. Just warning shot. And give the bad news in pieces. Okay? Not all the bad news. This is just the first only comment. The only comment about the performance. Okay?
Yeah, I have another comment, Dr. Hani, plus your comment. Of course, it's important to prepare the surrogate or the relative. And another point, you can prepare your patient or your surrogate by inviting someone. These scenarios, such type of scenarios, you can or you must invite someone. And the patient or the relative will feel worried, something ongoing. So from the start, do you want anyone to attend this meeting with you? She will know there is something cooking, there is something very bad to know or to hear. So from the first point, those scenarios with loss of some of beloved person or father, mother, the husband or wife, you can invite, and not only to, you can encourage also. You want anyone to attend this meeting. Why, doctor? Anything happened? Now the relative will feel there is something worrying. Okay, so such scenario, please try to invite. And the other point, are you the next of kin? Because it's confirming a point. However, it must be the next of kin because you are discussing the cause of death or a major event in her father condition, which is the death. Okay, so try to confirm the next of kin. Are you the next of kin? Do you want anyone else to attend your this meeting with you? Why, doctor? What happened? And as Dr. Hani said, the warning shot. I'm so
Yes,
sorry, I don't
please.
have good news today for you. And
Yes,
try
sorry.
to say it clearly. Your father is dead now. I'm so sorry to say that. Okay, don't say passed away or other words. Your father is dead. Clear. And
Okay.
give her the time to react. Tissue, water, whatever you can offer, but don't say we can postpone the meeting. Support her. Tell her we
I'm
will.
sorry, I
Yeah.
don't want to postpone. It's only to cut the ice, as they say, because when he becomes silent for a while, I just wanted him to talk again. So
Okay.
when I
As
tell him, would you like to postpone the meeting? I don't want to postpone. It's about to ask him to answer my question and come to the conversation again. That's all. It's
no.
not about
Yeah,
postponing. Just
yeah.
to tell
But don't
him,
offer
yeah.
it in the exam. Don't offer it. What you want to do? Offer tissue. Offer a glass of water, as you said. Give him
Uh-huh.
time to react. Okay, I try to appreciate her feeling and reaction. Of course, she has to react. This is her father, and this is
Yes,
the
I
death.
understand.
Yeah.
I understand. But it's like about
Yeah,
like,
yeah. The sentence itself is not good to mention it in the exam.
okay, okay,
Okay.
okay, no problem. Okay, Dr.
Yeah,
Best.
this is the point. Otherwise, mashallah, even the corona, do you remember? After a procedure or during a procedure or unexpected death within 24 hours, all of
Yes.
them you must invite or you must raise the point of coroners. The coroners will discuss or they will investigate what exactly has happened with your father, and we will let you know. Regarding death certificate, I'm so sorry, it's not to be issued by us, it will be issued by the coroner team. Okay? Because
Okay.
this is one of the concern. At the end, good question to ask with whom was living and who's dependent on him, and any type of support, not only financial. Okay, any
Mhm.
type of support your family need, we are here to support you. The most important team here to invite are. Do you know the name of the team? Anyone know the name of the team? Bereavement team. Bereavement team. So those team or people who can come and say to the family, socially support, psychologically, and religious, they can support the family regarding the loss. Okay, clear? Bereavement team. It's very important to mention this team, and this is the only time you can say this team in the paces. Bereavement team. Clear for all?
Yes,
Dr.
yes,
Azza?
sir.
Yeah,
Yes,
okay.
sir. Thank
If you
you. Thank you.
please, yeah, you have scenario for Dr. Hani, you can give him scenario.
I didn't prepare. I didn't prepare. So
Yeah, it's okay.
if you
If you
have,
can take some minutes to prepare any
No
okay,
problem.
scenario.
to
If
do the
you,
scenario,
if you,
okay, I'll do the scenario for him. Okay, just a minute.
Okay, so I can give you as a judgment. Really, you deserve the full mark. Nothing missed apart from the point we already mentioned, but it's just to be complimentary, not as a defect. Okay. Any comment or question from others? Any comment you want to add, Dr. Hani?
about this is that should be reported to the coroner.
Mm-hmm.
I think it is this is that are sudden or unexplained, and also this is where the case has not been attended by a medical practitioner for their last illness and within 14 days before death. Uh, Also, this is occurring after an operation,
Yes,
uh,
exactly.
occupational disease, lack of care, self-neglect, suicide, and self-harm violence.
Yes, and fight also. If
Mm.
there is a fight, patient admitted after a
Th-
fight. Also, this is a police case. Coroner must be involved. Okay.
this is in police stations or prison or
Sorry.
following admission. The death is in the police stations or prison
I mean,
or
after death,
yes,
any
yes,
any police case had death, you must involve the coroners. Already they are
yes.
following, but you cannot
Mm,
release the body, the dead body, unless the clear cause of death already explained or investigated.
mm. Okay.
But in cases, you might see it in two conditions. Unexpected
Mm,
death after admission. Patient admitted, young patient with just pneumonia, admitted today, and in the ward he had cardiac arrest and passed away. What happened? You have to investigate through corona. The second scenario, if patient had PCI or procedure as our scenario today, procedure, and after the procedure or during the procedure, patient also did unexpectedly. This is another coroner scenario. In PACES, you will see them in two scenarios. There is a lot of them, but in PACES, you might face it in these two scenarios. Okay. Other scenario, if death happened and there is something unclear, you might involve the post-mortem. And this is a medical decision. patient admitted and he was okay, improved. After he improved, he deteriorated again, and you suspected pulmonary embolism, suspected underlying malignancy. You want to know more why this happened? For the research purpose, you can do the post-mortem study. But it will not be within 24 hours. So patient admitted already for 2 weeks, and after he improved, deteriorated again. They want to know what happened exactly. Okay.
Okay.
Okay, thank you, Dr. Good question from Dr. Isam. Organ transplant can be raised or it's optional. In what scenario? In any police case scenario or coroner scenario, it's prohibited. Don't raise this issue at all. Organ donation for brain stem death only. Whenever you read in the scenario organ donation as a task or brain stem death, brain stem death. Of course, you will have patient with coma. So you will not have a brain stem death without coma. You will have a coma patient or comatose patient, and they confirm the test of brain stem reflexes, which is lost. This is the time to talk about organ donation. Okay? Not in our today's scenario. Already patient did passed away. You cannot talk about it. The brain stem death, still other organs are functioning, like heart, like kidney, like liver, but the brain already gone. This is the time to take organs, and you can take, as I said, liver, kidney, heart, lung, cornea, bone marrow. But what if the heart stopped? You cannot take anything. The clinical death, you cannot take any organ, and don't offer it in any police case. This is in general. You cannot talk to a family with something hidden or uh, something unclear for the family, and you will tell them, we will take the organ of your daughter or of your son, of your husband. Okay? It's conflicting for the family, how you are saying that, and still you don't know the cause of death. And it's not medically accepted to do it unless he has brain stem death. Again, it's very important to read this sentence in the scenario to talk about organ donation. Brain stem death. Otherwise, don't talk about organ donation. Okay, thank you, Dr. Assam. Dr. Azza, we are waiting for you. You have it? Hello? Okay, tell Dr. Azza prepare the scenario. Today, as before the Eid vacation, starting from, this is the last session, I mean. Anyone want to ask anything, to discuss any point, either now or after the last scenario or the next scenario? So we'll take 1 week off, starting from tomorrow. Tomorrow is Sunday, and the end of this vacation will be the next Sunday. We will resume our activity on Monday, the day of short clinical station. So the next Monday we'll start our activity. So anyone has any doubt, any point, any question? Anything you want to discuss, it's okay. It's open discussion. Okay, we'll give. Yeah, Dr. Asila asked about bereavement team. Okay, I will write the name now of the team. Okay, this is your scenario, Dr. Hani. Mr. Ahmed, 54 years old, with a chest X-ray showed mass 2 weeks ago. Now he came again to his appointment, very angry for further discussion. 6 weeks ago, he went to the GP with a cough and antibiotics was prescribed for him. Later, he had hemoptysis, and the GP asked for the X-ray. Unfortunately, you have to discuss with him. He might have lung cancer. I hope it's clear for you, Dr. Hani.
Is it clear?
Yes, yes, it's clear.
Okay, it's
Okay.
uncertainty. Dr. Asil, I will write for you that the team, bereavement team. I wrote it here. I Google it. In Arabic, it's translated as فريق الدعم النفسي في حالات الفقد. This is the major definition of the team. The bereavement team, the team who support the family with a loss. Okay, so it's clear. You have to mention this team. Bereavement team. It's clear now, right? Again and again, any loss scenario for any reason, trauma, cancer, or any diagnosis, you have to invite someone in the beginning of your scenario. You give an idea there is something bad coming, you prepare the surrogate, and you get the mark. Because at least he should be informed that there is something ongoing by inviting someone. So, do you need anyone to attend this meeting with us? You prepared him for a bad news. Okay, I can say as a unique indication in basis to invite someone, this is the on top of them. You can invite for other bad news, cancer, palliative, end of life, but on top of them, loss. So what after loss? Nothing. You have to invite for the meeting. The end of life care as well, the second priority. But the loss, of course, you have to. Okay? Second one, end of life. Second priority. Other scenarios, you might or you might not. But these two scenarios, you have to. You must invite someone to attend the meeting. End of life care and the loss. Also can be mentioned in the end of life. Yes, I just mentioned it, Dr. Anna. Thank you. So as a recap, in any loss, you have to invite this team, as well as the end of life care scenarios. In the breaking bad news for a diagnosis, okay, you can invite, but it's not a must. Or anything else, it's not a must to invite. But on top of them, again, the end of life care, then, or the on top of the list will be the patient loss. Dr. Hani, whenever you're ready, let us know.
Okay, we can start.
Yes, here you go.
Hello there.
Hello, doctor.
I am Dr. Abdul Hafiz, one of the doctors in the clinic today. Can I confirm that I'm talking to Mr. Ahmed and you are 54 years old?
Yes, doctor, it's me.
Okay. Mr. Ahmed, I am here to discuss your health condition. Is it okay with you?
Yes, doctor.
Okay. So before we start and to be in the same page, can you tell me how much you know about your health condition so far?
Okay, doctor, 6 weeks ago, I had this cough and this chest problem, and I went to the GP, and he prescribed for me some antibiotics, which didn't work. And after that, I was coughing up blood as well. So I went back to the GB 2 weeks ago. And when I told him that I'm coughing up blood, he asked.
Oh, there's interruption in the sound. There's lagging in the sound.
Okay, sorry.
Yes.
Yes.
I think my internet connection has a problem. Sorry.
Mm.
It's okay now?
Yes.
Okay. Which part you didn't hear? When I went to the GP 2 weeks ago, he asked for the image. And I'm here now to discuss the results of this image. And I'm really angry, doctor, because it takes 2 weeks to have this appointment with you.
Okay, I am sorry for your suffering, Mr. Ahmed, and be sure I will do my best today to help you. Uh, so, Mr. Ahmed, if you let me to explain uh, about the result of the chest X-ray. Actually, the result of or the report of the chest X-ray released, and it is with me now. But I'm sorry to tell you that it is not as we hope.
What do you mean, doctor? Is it serious?
I am sorry to tell you, Mr. Ahmed, there is a suspicion of there is a mass in the lung. Mass, I mean by mass, it is overgrowth, suspected overgrowth. Just we need to do more imaging, like CT, uh, to confirm what is the nature of this mass. Are you with me?
Oh my God, doctor, do you mean that I have a lung cancer?
Uh, Actually, I'm sorry to tell you, it is lung cancer. It is one of the suspected diagnosis here. So just we need to confirm our diagnosis by further investigations.
Oh my God, doctor, am I going to die?
I am sorry for that, and I appreciate your feelings. But we will try to do our best to save your life and to give you the proper management plan.
Okay, doctor, what if it's a cancer? And how will you confirm that it's a cancer? Is it the image again? Another image again?
Yes, that's right. We will do another image, and after that, we maybe need to take a snip from this overgrowth or this mass, okay, to confirm the nature of this mass. It may be cancer, it is not the other overgrowth. So we need to do this investigation to give you the management plan.
Okay, doctor, are you going to admit me or what? I don't understand really.
Yes, we will admit you, okay, because there's this coughing of blood, and we need to do these further investigations. After that, after finishing our further investigations, we will decide uh, what happened after that. Are you
And
following me?
if it's a cancer, do you think that you can remove it?
Uh, yes, I appreciate your feelings. I appreciate your concern, Mr. Ahmed. If this confirmed it is a cancer, we will refer you to a team of doctors, cancer doctor, Macmillan nurse, and to give you the details of the management plan. Maybe if it is yearly cancer and can be removed by surgery. If it is advanced cancer, it may be treated by a type of treatment called chemotherapy or radiotherapy. So all these details will inform it to you by the cancer physician. Are you following me?
Oh, good, doctor. If this GP has, diagnosed me from the first, I wouldn't be here now. I want to complain that GP.
Uh, I appreciate your concern, Mr. Ahmed, and I know how much you are frustrating about that, and anyone in your position will feel this things. But we need to investigate for what happened, why this, why the GB not do investigation from the start. I will call try to call the GP and investigate what happened and give you feedback for that. But in general, I am not defending actually my colleague, but I will try to explain that situation which we are facing a lot in our medical field, that many diseases could mimic each other and may be presented with similar symptoms. Mostly, maybe you will present with mild symptoms and without alarming symptoms in the first presentation, which not indicate for further investigation. But and I want to also confirm from our practice, a majority of patients with cancer are diagnosed lately with advanced stage. But as I said to you, I will investigate and I will call the GP to investigate what happened exactly.
And if you suspect that I had a lung cancer, doctor, I did this image 2 weeks ago. Why it takes too long time to have this appointment with you?
About the appointment, I don't know for what happened exactly. So I will investigate the issue and I will investigate why is this appointment not given you in urgent manner, because as you say, there is a coughing of blood and it is a serious condition need urgent appointment. Why is the delay this happened? This will be investigated and I will give you feedback about what happened. How does it seem?
Yes, I will complain, doctor. I will complain because it's my life, people. It's my life.
Yes.
And
yes,
you don't.
Actually.
Okay, doctor. Do you think that
Definitely.
my complaint will affect my management?
Sorry.
Do you think that if I complain, you will not manage me?
No, not at all. Definitely, this is your right to complain, to raise
2
complaints.
minutes. 2 minutes left.
Okay, and I will help you by referring you to the patient advice liaison office, and by myself, I will follow up the result of your complaint, and be sure that the plan of management of you will not be affected, and be sure will not be any discrimination at all.
Okay, doctor. Thank you.
Okay, can I ask you some questions, personal questions, please?
Yes, doctor, you can.
What are you doing for a living?
I'm a driver.
And how is this affecting your daily life and your job?
I'm feeling tired, doctor, so I didn't work these last 2 weeks.
Okay, I will try to help you on this issue. Okay, and if you need any support from our side, you can tell me. Okay.
Okay.
So, do you drink alcohol?
No, doctor, I don't drink.
Do you smoke?
Yes, I smoke.
Okay, I advise you strongly to stop smoking, because it is actually one of the cause and risk factors for any cancers, especially lung cancer. So I advise you to stop smoking. How does it sense to you?
I'm trying for a while, doctor, to stop smoking. Thank you for your advice.
Okay. So I will give you some brochures and websites to visit to read more about this problem. And if you have any query, please contact me directly. Okay.
Okay, thank you, doctor.
Okay, time is up. You can comment now, Dr. Azza, please.
I don't think that I have any comments, really. He did it very well. And it's uncertainty, so there is no much to say about the managed plan. He's totally right. The problem here is that the patient is angry and he come because 2 weeks for appointment and 6 weeks for the complaint without any That's why he want to complain the GP and he want to complain you. So he has two complaints. Okay. For the mass itself, you don't know if it's a cancer. They write for you it might be a cancer, so you should raise this suspicion for him to take it seriously. What I write here, like what you said, I'm sorry for what you have been through, and I understand your feeling, and you have the right to complain. If you allow me, I want to discuss with you what are going on to do next. We need to do further scan, the CT you said, okay? You should say a scan, not a CT for your lungs, and we need to take a snap. You told that later when I told you how you will know another image, so you picked it and you told me about the snap. Okay, it's very important in a lung case, and we don't know what is the exact mass we are dealing with. It could be a cancer. The best treatment can't be known right now. We know to be sure about the growth itself. Is it a cancer? And we need to stage it if it's a cancer. We need to do further scans for your body as well. That's all I have in my notes. And I think it's only about angry patient, how to deal with, and the further management, as you told Dr. Hani very well. Sorry, I didn't prepare the case, so it was free. Okay.
No,
Okay,
it's
thank
good.
you.
Yeah, good and very fast you prepare. But I have comment for Dr. Hani. Regarding some questions, and the answer is not clear and direct answer. For example, will I die, doctor? What should be the best answer here, Dr. Hani? Will I die, doctor?
Uh, we can't expect that.
And it's
Okay,
so early, right?
but
It's
It's
so
too
early to
early.
answer.
It's too
Yes,
early to say
it's
that,
so
yeah.
early to answer this clearly. I cannot give you exact, and it's not detected with us now. We don't have a clear diagnosis. We are trying to have a good and clear diagnosis for your condition. But if he specify a question for the cancer, what if I have a cancer, doctor? Will I die? So be
He
careful.
said about the scan, he said about the SNP to stage the disease to know what exact is the cancer, which type. So
Okay,
he
so
said all the options, the surgeries, the radiotherapy, the chemotherapy.
no, I'm not
We
talking
don't,
about management plan. I'm talking about exact point, which is will I die if I have uncertain now I have uncertain diagnosis, right?
yeah.
So it's so early after like, having a clear diagnosis, we can answer this question. Okay, what if I have cancer, doctor? Will I die? So two questions I asked now.
Uh-huh,
One for
uh-huh.
uncertain and the
But
other
if it's
for cancer.
confirmed, uh-huh.
Confirmed cancer. So what about the answer for the confirmed cancer?
It's
uh,
shortened its life, yeah.
Exactly, yes.
Yeah.
Usually the cancer shortened the patient life, unfortunately. And you have to be sorry while answering this and with the reduced tone. Be more empathetic while talking in this point. I'm afraid to say the cancer itself shortened the life of you or your condition or whatever the person you are talking with, okay? Okay, this is the answer for cancer, confirmed cancer. But what about now? Patient doesn't have a clear diagnosis. How I can tell him when he die? It might be something good, benign, or it might be a cancer which have another staging. So it's so early to answer this question. Okay, this is regarding the point of will I die? There is another point. Doctor, 2 weeks, you didn't give me a time or appointment for 2 weeks. Do you think the 2 weeks will matter with him or with his condition? I don't know what are the situations, but I'm
He has
just
hemoptysis. That is the emergency. It's not about the cancer itself. It's about the hemoptysis. If he's losing too much blood,
yeah. This is another point. No, I misunderstood it for delayed referral, not for the hemoptysis. For
it's
the
delayed also. But the hemoptysis is already there from 2 weeks when he went to the GP again, and the GP asked it for the X-ray
okay.
and takes appointment to refer him. So the referral takes two weeks to be
Yeah,
referred to
this is
the
another. So this is a delay. Yes, you're right. So
yeah.
we have to
Mhm.
apologize for this delay. However, it's
Yes.
not from our side. This is from the GP side.
Mhm.
Okay, I have another comment for Dr. Hani. Will you investigate all these things by yourself? You kept saying, I will investigate. I will investigate the delay. I will investigate the misdiagnosis. I will call the GP. I will. Is it a professional way?
Actually, I don't know. So I
No,
must refer
it's
him
you
here.
are you are one of the team. Always remember this. You are one of the team. You are a member, not a team. You are not the team. You are one of the member. So we will, or we will refer to your GP, or you can talk to your GP because we don't have. By the way, in UK, the GP doesn't have a direct contact with the specialized team. The GP refer you to the hospital, and the hospital will refer you to the GP. Sorry, to the specialized team. But a clear or a direct link between you and the GP, no. Who are the responsible? What we call it? GP surgery. Okay, this is in UK. I don't want to go more in details in this point, but you are not the one responsible. So we will try to know what happened exactly. Don't say I will, and you give her like a promise. I will follow myself with this point. It's not preferred point. Okay, whenever you are saying something you have to do, try to mention the team. So we will try to investigate and to know why exactly this happened. We will try to know why your GP didn't give us a referral urgently. Okay, we will try to have a contact with your GP. Don't give a promise. Don't say, I will promise you or I will follow myself because this is not your job. What if you lost your job here in this hospital? You'll be the one responsible? No, this is a team responsibility. So we are trying to do so. We are following this. Okay, always talk in the way of we as a team, not as I am the one. Okay, this is not only for following an issue or investigation, even for the management plan. Whenever you are talking to the examiner and he asks you how you manage this patient, don't tell him, I will do this and that. I will do the investigation of. Yes, you can say, I would like to send for, but you are not the specialized team to do all the things. That's why we are preferring always to start the answer with multidisciplinary team approach. I will call for the hematologist, ophthalmologist. Multidisciplinary means, and you mention it in this team, which is good point in this scenario. Macmillan nurse, cancer doctor, even you can say the surgeon, because you give her the option of surgery, which is good option also. She asks you clearly and direct question regarding the surgery. If there is any possibility to do a surgery, we will see after investigating and having a clear diagnosis. We will refer you, as you said exactly, we will refer you to the team of doctors, including the surgeon, cancer doctor, Macmillan nurse, and the respiratory therapist, for example. Anyone will be involved to be giving a clear management plan, as I said, as you said, okay? Otherwise, yeah, just try to avoid I. Don't do it as you are the one. We are, or we will try. Okay. Try also to have another phrases. Not only I appreciate your feeling, I appreciate your concern. Try to say I. You said one of them. Yes, it must be difficult for you. I can imagine you. You said that I think it's so stress for you. Um, I can. I think also you said disappointed because of the delay management. Yes. So I mean, try not to repeat the same sentence that I appreciate your concern. Okay, and don't say I understand. Try to see say I can see how much you are distressed because understand they don't prefer it because you don't understand the patient feeling, but you can see. Okay, and this is one of the points you can also try to improve in the phrases. It must be difficult for you. could be quite difficult for you. Try to find some phrases different. I appreciate sharing this with me. It's a valid concern. I appreciate this question in this way. Otherwise, perfect. The clinical judgment in this scenario was perfect. What I will minus you in the clinical judgment and the clinical communication only, okay? Because you mentioned I will in most of the sentences. Any comment, Dr. Hani, or question?
No,
Um,
thank,
I just
thank
want
you.
to add something, Dr. Person.
Yes, Dr. Azza, sure.
The complaint for the GP is through the practice manager, or
Yes.
you can say that you can go to the website and you know the exact process of complaining. But if
Okay,
you want to complain, you can say the patient advisory liaison service. Yes.
perfect. Yeah. Anything in the hospital, patient advice liaison services, anything related to the hospital management. Outside the hospital, you can refer him to the pulse, and the pulse will guide him to the GP surgery or service. But in this way, pulse, you can involve it in any way if you have a GP issue or a hospital issue. But if he has a clear GP issue, let him have a contact with his GP, or you can tell him contact the GP surgery or the GP services. They will give you a clear investigation plan. Okay. Anything else, Dr. Azza, you want to add?
No, Dr. Bassam, thank you. You covered all.
Yeah, perfect. Thank you, Dr. Azza. Dr. Hani, also, you want to add any question?
No, thank you, Dr. Bas.
Okay, most welcome. Anyone has a question regarding first or second scenario? Any misunderstood point? Any unclear points?
There's one of the scenario, Dr. Bassem,
Sure.
like this scenario, but was delay. The cancer is advanced and with metastasis. Okay,
Yes.
and there is also issue also of uh, delayed diagnosis.
Mhm.
Must we raise in this scenario the issue of advance directive or power of attorney of living wish or like that?
No, 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 no. You have delayed diagnosis. So you have
Mm.
angry patient,
Mm.
right? Most
Yes.
probably the patient will be angry. Never
Mm.
ever try to ask advance directive to angry patient.
Uh,
Okay?
if the scenario it was not delaying, just breaking bad news of
Okay,
advanced
yes, you
cancer.
can ask. You can ask.
Mm. Okay.
Any advanced cancer and already diagnosed properly, patient know about his condition and he knows that he's under palliative therapy. Now you can ask about advanced directive. But there is no delay, there is nothing make him angry, like delay management or medical error. Okay?
Okay. Thank you.
And metastasis means palliative. Okay?
Mm.
Metastasis in a scenario means palliative therapy.
Mm.
Unless the patient is deteriorating, worsening, he's going to die. Now you have to talk about end of life care, and it will be including the DNR.
Mm.
Clear?
Okay.
It's a
Thank
game, Dr.
you.
Hamid. It's a game you have to know how to play it. The communication scenarios, uh, I know it's nightmares for some of you, but it's a game. If you know how to play it, what to discuss in this scenario and what to raise, what to avoid, you will fulfill the criteria, you will gain the full mark. But if you kept panic with any scenario, what I do here, you will be more panic and you will not do anything. So you have to be safe, professional, and to deal with the surrogate, be calm, don't be panic, and answer every concern. I think Dr. Azza today gave us a lot of concern, which is perfect point. And this is the way in the exam. You will have a surrogate with a lot of concern. You will not give the all information. The surrogate will have a lot of concern, and you have to address every concern. And this is the best way to teach. You prepare a scenario with a full 5 to 6 concerns and to see how to answer every concern. Otherwise, if the if you do you think the communication scenario is to just explain, no, it's not just explain. Be ready to have a concern, which is maybe the first time in your practice. Okay, as our scenario today, Dr. Azza gave you a lot of concern. Will I die? What happened with my GP? Why I have delayed diagnosis? What the management plan? Okay, although the scenario is breaking bad news and to explain the condition, but still she kept giving you a concern, which is the task in the exam. You will not have the time. Yes, you have the time to give the task, but be sure there is a lot of concern you have to address. So be ready to address every concern in the exam and to be professional while you are answering. Be safe. Don't give answer if you don't know it. If you are not sure about it, don't give it. You can refer to other team. You can involve another team. You can ask your senior. Okay, but don't give an answer unless you are sure about it. And every address or every concern, try to prepare. I appreciate your concern is valid. I understand this question. I will answer this. Okay, any phrases, try to use it in your practice to be ready to answer these concerns. Any question else? Any question for basis or communication or long clinical? Anyone has a doubt about any point?
Dr. Basim, can you ask if there's any confirmed seats? Anybody received emails for the
Uh,
next slide?
I think yes. Nowadays they receive some doctors received some emails.
Which center accepted?
Cairo. Yeah, I think Dr. Ala answer. You can contact Dr. Ala.
السلام
Cairo.
Okay.
عليكم.
عليكم السلام.
أنا أكسبت في جدة.
Okay, good. This is a new center.
نيو سنتر، وصراحة يعني الخوف والتكيكارديا وكل الحاجات الما كويسة.
دكتور هو sorry دكتور
أنا
سهير.
سهير يا دكتور باسم.
اوكي دكتور
كان
سهير.
امتحنت المرة اللي فاتت في عجمان وما توفقت.
اوكي. Um, Actually it's
Who
a
gave
gamble.
the seat in Jeddah? Dr. Who? Sorry.
دكتور سهير.
Okay, Dr. Sohair, can I contact you?
أوكي.
Subhanallah. Maybe one question at the end of the session make a partner study. Maybe you
Yeah,
can.
yeah.
Subhanallah. Anyway, what I want to say to Dr. Sahir, it's a gamble, okay? Be sure this is a gamble. New center, you don't know what will happen. And what are about the examiners? Are they good? Are they kind? Are they fair? You don't know. But what you have to do your best, okay?
أوكي
Maybe
إن شاء
the
الله.
center will be a good one and it will be, inshallah, famous, benign center. Or, and we will know that from the, of course, the feedback, and we'll know from the pass mark. Or the other, as other centers, other toxic center. Usually, the new center to be published and to be more famous, supposed to have good pass mark, especially if this is the first center in the whole country. I remember Alexandria when the center appeared, started to have the exam, they didn't pass a lot of us. But this is the third center in Egypt, so they don't need to be a good center. Okay, but in Saudi Arabia, the situation is different. This is the first center in the whole kingdom. So I hope and I wish they will be good center. And the good news, I hear that the all or most of the examiners will be external. So they will come from UK. And be sure that the UK doctors, they are not toxic, but they are fair. It's opposite from other center like Alexandria Center. You have toxic doctor. The local doctor are toxic. Okay, they don't pass easily. But the good thing in the British examiner, they are fair. So they will give you according to your performance. So they will judge you fairly, hopefully, of course, but they will not be that much toxic. What about the
إن
local
شاء الله.
doctors? I don't know. The local doctors will be Saudi or there will be Egyptian working in Saudi Arabia or other nationality working. But the good thing, most of the Gulf center, the local doctors, they are not toxic. Why? Because they don't have any objection to pass you. You got my point.
Yeah.
In
Yeah.
Egypt, they have this objection. They don't like to pass you easily. Why? Because there is some political issues in Egypt. If you pass this exam, you might compete with them, blah blah blah. But in
Okay.
Saudi Arabia, they don't have this competition. What if you pass? They don't matter if you pass or not. This is my point. So hopefully it will be good center. And the good also thing, you will not travel, you will not have visa, you will not have transportation, no accommodation, everything. Just before the exam, you can go one day or the same day even, if you are in Saudi Arabia.
Yes, this is the most important for me
Yeah.
because I am here with a visa,
Yes,
visit
exactly.
visa. That is why I cannot go out and come again.
Yeah. So use this one. At least you will not travel, you will not have visa. Okay.
Inshallah.
Yeah. Hopefully, inshallah, you will pass it. Any time, Dr. Said, you can message me if you want any
Mm.
help.
Okay, Dr. Basim. Shukran.
Thank
And I can also I hear your advice regarding the basis. And one of my problem, exactly what happened for me, I am afraid from the first case, long clinical consultation. When I enter inside the room, I didn't know how to start. I don't know with whom I will speak. When I saw the examiner sit, you see, at that time, eh, I miss everything, even how to start the scenario or the
Mhm.
question for the history. I didn't remember,
How to
and this
solve
is
this?
the
Yeah.
first. This is the first station for me. So after
Mm.
that, my mind block.
Mm. Yes, of course. Yes. You don't have the confidence to overcome this. This is the point. You have to be confident. How to gain this confidence? By practice, practice, practice. It will be like subconscious. You are getting inside the station, starting quickly without thinking. The question will come frequently, without fluently, without any thinking. This is the way whenever you are practicing frequently. But if you just, I will do it in the exam, believe me, the stress will kill you. It will not help you to do this. The stress, the doctor who can control his stress in the exam, who can pass this exam. If he couldn't, or if she couldn't control her stress, unfortunately, mental block will happen. The
Yes.
unsystematic way, the answers will be unprofessional. You will be unsafe. Everything, every mistake you will do.
Yes, yes, this is what happened for me exactly. And even when I want to examine the central nervous system for this pinprick
Mm.
sensation,
Mm.
I found this needle for blood sugar check.
Oh my God.
Then I thinking I will use this. This is not
Mm.
harm the patient. Maybe 2 minutes I take for thinking I will use it or not. For
No time. No, it's don't. It's not advisable to use the pinprick for blood sugar. They don't like this, and they might minus you in the welfare. There is a special pin for pinprick sensation.
but
Ask
they
it.
put this.
No, 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 no. Tell them I need to do the pinprick. Be professional. This one to check blood sugar.
Actually, Dr. Basim, they put it
Mhm.
for me also in Alexandria.
Okay.
This diet, but I asked the examiner. I asked him, I can
Yes.
use this. He told me,
Yes.
yes, you can use
Okay.
it
If
Yes,
you
I
ask, if
directly.
he said yes,
with
خلاص, the responsibility from the examiner. But
yes,
don't use it
yes.
as I will do it by this, like this is the default one. No. Supposed to have the pinprick for the examination for the sensation will be not harmful. This one is harmful.
Yes, I take it and I ask the patient. And I told him this will be some
Hmm.
painful for you, and he told me proceed.
It's unhuman,
Mm.
really. It's unhuman to do it on a person to scratch him with this pin. Very sharp.
Yeah, yeah.
I think in Saudi Arabia they provide everything. They are rich.
Mhm. Also, I want to ask you, Dr. Basim, about this. I want to use propanolol. Actually, this is
Yes,
the
use
last
it.
thing.
Yeah, yeah. I used it. I used it. Yes, use it.
Uh,
One day
Only
before the
before.
exam and the morning of the same day of exam. one day and the day before. 10 milligram.
Okay, thank you.
Most welcome. And sleep well. It's very important to sleep well, okay?
Inshallah, inshallah.
Inshallah. Good luck to you and everyone. Any question else? Anyone has a question? So we'll thank Dr. Hani, Dr. Azza, and wish you a long vacation to pray, to enjoy the Eid, and we'll be back on Monday after Eid, inshallah. Eid Saeed for everyone, and enjoy your time. See you, inshallah, after 1 week. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
عليكم السلام.